For coming to my presentation on STIs among adolescent males. The first STI, which is one of the three most common in adolescent males, is syphilis. Treponema pallidum is the name for the bacteria that causes the disease of syphilis. There are 4 stages. This disease is prolific in the spread due to varying stages of disease and periods of latency or no symptoms. The first stage of syphilis, or primary syphilis, is also called the canker phase. This is because a painless ulcer is often seen at the site where the patient was contaminated, such as the head of the penis or around the anus or periorally. This can last approximately 10 to 90 days. The next phase, or secondary syphilis, is noted when there are sores on the heels and the palms, and multiple systemic symptoms present. These include, but are not limited by, weight loss, headaches, muscle pains, and enlarged lymph nodes. The most identifying symptom of the stage is a rash that appears on the hands and feet. Many times, syphilis at this phase is left untreated, as symptoms usually disappear after a few weeks, even without any treatment. Symptoms may return or relapse after up to 12 months. Approximately 1/3 of patients with secondary syphilis will progress to a third stage if left untreated. Tertiary syphilis is considered late stage and can take anywhere between months or decades to develop. This is categorized by the bacteria invading internal body organs, such as the heart, the central nervous system, so like the brain and spinal cord, the liver, the testes, etc. Between each stage of syphilis can be a 4th category, which is latent syphilis. It is for this reason that syphilis is classified by 4 groupings. We briefly mentioned this, but manifestations occur based on the stage of disease if left untreated. The diagnostic testing, there are multiple ways that a clinician may test you for syphilis. I will briefly review some of the most common laboratory tests. There's serologic testing, which means a sample of blood is evaluated for antibodies to that bacteria. There's point of care testing, POC. In high-risk communities with limited resources, a drop of blood is collected for rapid testing, same-day testing. These result in some false negatives, but they are valuable in communities where follow-up care is doubtful and the rate of disease is high. This is also used for like the at-home testing that you can sometimes get over a video visit. So for treatment, penicillin has been the go-to treatment for syphilis for many years. For all stages other than late-stage syphilis, a single intramuscular injection of a long-acting penicillin is sufficient to cure the disease. When we talk about prevention, we really want to have barrier methods of sexual contact. That means either a male condom or a female condom. Doxy-prep is another option for at-risk individuals. Doxy-prep is some antibiotics that you would take immediately after a risky sexual encounter, and it has been trialed in San Francisco and resulted in a 50% rate reduction. For screening recommendations, MSM, or men who have sex with men, or men who have multiple sexual encounters may need screening up to every 3 to 6 months. CDC recommends at least annual checks for men who have sex with men or men with risky sexual encounters. Some geographical areas maybe have different recommendations if they have higher rates of disease. So next, we have a question. Can syphilis be spread through oral sex? Yes, syphilis can be spread through vaginal, anal, and oral sexual contact. So it's a common myth that you cannot get an STI from oral sex, and that is not correct. The next common STI among adolescent males is chlamydia. Chlamydia trachomatis is the most common STI and bacterial infection in the United States. It occurs usually in two forms. The elementary body is considered infectious, but it's not yet activated. It won't cause disease. And the reticulate body will cause disease and replicate into elementary bodies. Chlamydia is difficult to eradicate as many exhibit no symptoms, especially males. However, chlamydial infections can cause long-term health complications in women, so it is important to get screened if you have multiple female sexual partners. When chlamydia does cause symptoms in men, it's identified by causing irritation to the infected mucosa or genital tract, such as the urethra, prostate, epididymis, or prostate. Abnormal discharge and fevers are also common symptoms. To diagnose chlamydia in men, a urine sample is recommended to test for DNA or RNA that would indicate chlamydia. However, the USPSTF also states that white blood cells in urine with the absence of UTI can be a diagnostic. Um, it can be a way to diagnose chlamydia, and this is common, especially when you have limited resources and high prevalence of disease. It is recommended that a person be tested for gonorrhea at the same time as chlamydia, as men are often infected with both at the same time. Treatment for chlamydia requires antibiotics. This can be either azithromycin or doxycycline. It is recommended that a patient waits 1 week after treatment before engaging in further sexual activity. The CDC offers guidelines for when men should be screened for chlamydia. Anyone with symptoms should be tested. Men with higher risk factors, such as men who have sex with men, sex work, high risk geography, or risky sexual habits, should be screened at least annually. To prevent yourself from contracting chlamydia, it is recommended to use a barrier method during sexual activity, such as condoms, to prevent direct skin contact. Another fun little question. What is a common health concern for babies born from a mother infected with chlamydia? Blindness. Chlamydia can cause neonatal conjunctivitis, which can lead to permanent vision damage. Lastly, we will be reviewing gonorrhea. Neisseria gonorrhoeae is a complex bacteria and the second most common cause of STI globally. Gonorrhea is tricky as pili, or little hair-like structures, aid in its ability to stick to epithelial tissue. Not only that, but a cellular structure called lipoligosaccharides cause the bacteria to be able to attach itself to one of the most motile cells in the human body, which is sperm, and that can aid in transmission. Men who are infected with gonorrhea are commonly symptomatic at 90%, while women can more commonly carry the bacteria without symptoms, 50%. Men will commonly report penile discharge, penile or testicular pain, or if infected in the anus or mouth, pain and bleeding at the site of infection. In rare cases, it can infect a person systemically and cause further issues like sepsis. Your healthcare provider will recommend a mucosal swab or a urine sample to test via NAAT or culture. While point of care testing, a more rapid option exists, it often varies in accuracy and is only recommended in very specific circumstances. If the treatment for gonorrhea sounds familiar, that's because it's commonly treated in conjunction with the treatment for chlamydia. You need 1 intramuscular shot of ceftriaxone, 1 gram, and that's often enough to eradicate the bacteria. One important note is that gonorrhea is rapidly becoming drug resistant. So if your symptoms do not resolve, please contact your healthcare provider. It is important to refrain from partnered sexual activity for 1 week after treatment to prevent you from getting reinfected or to spread disease. And while the only way to never contract gonorrhea, syphilis, and chlamydia uh, is abstinence, monogamous sexual relationships and barrier methods such as condoms can greatly reduce the spread of disease. According to CDC recommendations, routine screening for men who have sex with women is not recommended. Men who have sex with men or men with risky sexual tendencies should be screened annually, but depending on the case may increase to every 3 to 6 months. And here are my references. Thank you so much.